The pandemic panel held nothing back, saying the global devastation experienced over the past year and a half could not only have been averted, but was exacerbated by a toxic cocktail of poor coordination, unpreparedness, and protectionism.
This is an ongoing disaster that we believe could have been prevented. The evidence shows that an outbreak became a pandemic because of failures, gaps, and delays in preparedness and response.
While the panel hailed clinicians in Wuhan for quickly recognizing a cluster of patients with a potentially new virus, they lambasted the hoarding of information and the cumbersome nature of global systems designed to respond to health emergencies, likening them to an analog system in the digital age. The panel also criticized the World Health Organization for taking too long to declare COVID-19 a public health emergency of international concern. But some of the most scathing critiques were directed at rich Western countries, whose inaction in early 2020 led to overwhelmed health systems and a winner-take-all scramble to secure protective equipment and medicines.
Too many countries, including some of the wealthiest, devalued the emerging science, denied the disease's severity, delayed responding, and ended up sowing distrust among citizens with literally deadly consequences.
More than 3.3 million lives have been lost so far. To prevent history from repeating itself, the panel laid out a list of recommendations, including giving the WHO more power to swiftly investigate emerging outbreaks, something that may be controversial for some countries. It also calls for the creation of a new financing facility with a budget of up to $10 billion a year to fund preparedness.
Access to vaccines will be crucial to ending the current pandemic, and the panel called on rich nations to donate 1 billion doses to COVAX countries. It also said that while the U.S.'s decision to get behind patent waivers was a step in the right direction, vaccine makers need to voluntarily license and transfer production know-how. If that can't happen in the next 3 months, the group said the waivers should be triggered.